The meeting will come to order. First of all, I want to thank the witnesses for appearing today for our latest hearing on the potential negative consequences of the health care law on small business. It's been a little over 1 full week since individuals and small business could begin to enroll in the public exchanges created by the President's health care law, and outcomes thus far, predictably, have not been encouraging. The President promised his health care law would reduce health costs and provide affordable coverage to individuals and small business. Instead, a number of small businesses have told us that health care law is increasing the cost of health care significantly, and in some cases well over 50%. However, while outcomes such as this were predictable, time and again by me and many others, they are not the subject of today's hearing. What we are here today to discuss are some of the other unwanted outcomes of this health care law, namely what effect it has had on employment opportunities at small business. As the committee has examined in the past, the health law's employer mandate that businesses with 50 or more employees offer health insurance to their employees or pay a penalty is a disincentive for businesses to grow and add new jobs. This outcome is made worse by the health law's seemingly arbitrary definition of full-time employees as someone who works 30 hours or more per week. While most Americans and other federal statutes define a full-time employee as one who works an average of 40 hours per week, the health care law creates its own definition of 30 hours or more per week. The consequences of this 30-hour per week definition are all too predictable. Fewer hours for employees and administrative nightmares for small business. According to a recent survey of small business owners and executives, nearly 75% intend to take some type of action to avoid the health law's employer mandate, including moving more full-time employees to part-time status and reducing hours of current part-time employees to less than 30. In short, while most of the American public continues to place job creation as their #1 policy concern, the health care law creates the perverse incentive for employers to not only refrain from hiring new workers, but also to reduce the hours of current employees. The witnesses at today's hearing will explain the challenges the health law's definition of full-time creates and how it will affect the way they manage their business and provide for their workers. I'd like to now yield to Ranking Member Hahn for her opening statement.
Thank you, Mr. Chairman. Despite over 40 attempts by my Republican colleagues in the House to repeal, defund, or derail the Affordable Care Act, the law is still the law, and it is moving forward to achieve the objective of finally giving the almost 50 million uninsured men, women, and children in this country quality, affordable health coverage. Last week, the most long-awaited portion of this law went into effect as online health insurance exchanges opened across the country. These exchanges will mean lower cost and expanded coverage for individuals and small firms across the country. We should all be really pleased that finally the millions of Americans who have lived in dread that an illness or an accident could plunge them into financial ruin will finally have access to good coverage that they can afford. But today we're looking at a provision that could potentially impact small businesses and their employees across the nation. The health care law defines a full-time employee at 30 hours per week. This change was intended to increase the number of workers to whom coverage would be offered. This has been the debate on both sides of the unintended consequences for workers. This committee has heard claims from employers that they are cutting the hours of their workforce to avoid offering coverage on those employees. Some labor organizations, such as Teamsters, Unite Here, UFCW, have also expressed reservations about the possibility of perverse incentives created by this 30-hour threshold. Of course, the law isn't perfect. We may need to make some changes. Since the exchanges just opened last week, I think we might have a clear picture of this impact of this provision if we waited until we have a good sense of the proportion of people who have bought insurance on the individual exchange and when the small business exchanges are a little more established. I'm concerned about how this new definition impacts employees and small businesses, but I'm just as concerned about the widespread misinformation and blame being put on this law, misinformation specifically spread to deter Americans from seizing the very real benefits of this Affordable Care Act. One of today's witnesses will discuss whether reduced worker hours are due solely because of this section of law or the economy. We must determine if these numbers are a direct impact of the revised definition or some combination of it and other factors, like sequestration or a slow economic recovery. Accordingly, this hearing will explore the current and future impact of this new definition on our labor market. As with any other major laws, there has been much speculation about how the law will affect small firms. For this reason, it is important that we consider the legislation proposals to address these challenges and work to improve rather than repeal. This hearing serves as a starting point to examine the issue and start a dialogue so we can address it immediately. I'm open, and the President, I believe, is open to making sensible improvements in the Affordable Care Act. But when the opponents of this law are willing to shut the federal government down and risk the full faith and credit of the United States to destroy or at least sabotage this law, it's difficult to have a real conversation about what's working and what isn't. I hope that when the politics die down, we can have that conversation. And I think the Small Business Committee has a really important role in ensuring that this new law proves that it is affordable for employers and employees alike. Thanks to the witnesses for appearing before us today, and I look forward to this hearing.
Thank you. First of all, if committee members have an opening statement prepared, I'd ask that they be submitted for the record. I'd like to now take a moment to explain the timing lights. Each witness will have 5 minutes to deliver your testimony. The light will start out as green. When you have 1 minute remaining, the light will turn yellow. Finally, it will turn red at the end of your 5 minutes. And I'd ask you to try as you can to keep in that time limit, but certainly we'll be a little bit lenient if you go over. Our first witness is Raymond Keating. Mr. Keating serves as the Chief Economist at the Small Business and Entrepreneurship Council, a nonpartisan small business advocacy organization headquartered in Vienna, Virginia. Among his policy areas of expertise are taxation, regulation, the U.S. economy, and other small business issues. In addition to his position as the SBE counsel, Mr. Keating also serves as an adjunct professor in the business school at Dowling College in Oakdale, New York. Mr. Keating, thank you for appearing today. You could now deliver your message.
Thank you very much. Chairman Collins, Ranking Member Hahn, members of the committee, thank you so much for having this hearing today on the potential effects of the Patient Protection and Affordable Care Act, or Obamacare, on employment in small business. My name is Ray Keating, and as you said, I'm Chief Economist with the Small Business and Entrepreneurship Council. I'd like to highlight a few points from my written testimony and then add some quick points from a business owner, an SBE council member, who I spoke with yesterday to get a feel for what he would like to relay to the committee if he were here. Number one, obviously it's important to consider the impact of Obamacare within the context of our poor economic performance in recent years regarding both economic growth and employment growth. Just a quick rundown on a few numbers. Economic growth during this recovery has been running at about half of where we should be during a recovery. We're averaging about 2.2% real GDP growth. Historical average going back to 1950 is 3.4%. And during recovery expansion periods, it's actually 4.5%. So we're badly underperforming. That leads to problems on the jobs front. Throughout the recession and subsequent recovery, for example, the labor force participation rate, which has gotten a lot of attention recently, has been at a low that we haven't seen since August of 1978, 63.2%. Now, that certainly reflects an assortment of things going on in the economy, but very much a large number of people simply giving up and not bothering to look for work. Just to give you a little perspective, if we had a labor force participation rate that was a little more within the historical norm, the unemployment rate right now would not be 3%, it would be 12%. roughly. Now, given the Obamacare employer mandate and the definition of 30 hours a week as full-time, we need to look at full-time versus part-time employment. As for people who are working part-time but want full-time work, in August, this group registered 7.9 million. That's fortunately down from a peak of 9.2 million set in September 2010, but it's far above the pre-recession levels, more than double, for example, the 3.9 level that we registered in April 2006. It's also important to recognize a dramatic shift that we're seeing in 2013 as to part-time versus full-time job creation. During this recovery, during the whole recovery, a bit more than 90% of jobs created have been full-time. However, from January of this year to August of this year, 2/3 of employment gains have come via part-time jobs. That's a striking number. That's a striking break from what normally happens. And I think it does speak to the issue of how part-time workers are treated under Obamacare versus full-time. If we're going to look at job creation, obviously we have to look at small businesses. We're here in the Small Business Committee. And as we well know, that the bulk of new jobs, net new jobs, are created by small firms, small and mid-sized firms. And if you look at the trend there, we've seen a decline in entrepreneurship on a whole host of levels, whether you're looking at self-employment, business births, the number of employer firms, we've seen a dramatic decline. It's not that surprising then that we see a lag in terms of job creation among small businesses in this recovery. In the testimony, I highlight several polls of small business owners talking about their response to Obamacare. It hasn't been good. For example, 41% of owners in one Gallup poll said they held off on hiring new employees. 38% have pulled back on plans to grow their business. 1 in 5 have reduced their number of employees, and essentially the same number have cut employee hours in response to the health care law. We've got a new poll coming out at SBE Council that shows that 76% of small businesses are not going to hire, unlikely to hire within the next 6 months. Finally, I wanted to hit on this point. I spoke with Mike Frederick, who owns a small manufacturing firm in Wisconsin, 57 employees. And he relayed several frustrations with the new law, including, and he put a big emphasis on dealing with the very large administrative costs related to the law. He's got one person that works on this. He can't add anybody else. He's also looking at probably a 30% increase in premiums this year, and he faces the very real possibility of having to cut staff to less than 50 workers. To sum up, in a time of slow economic growth, lackluster job creation, troubling trends on the entrepreneurship front, we would hope that policymaking would be directed towards boosting incentives for private sector risk-taking, entrepreneurship, investment, and so on, such as broad and deep and substantive tax and regulatory relief. But unfortunately, when you look at this law and so many other areas, we've been pointed in the exact opposite direction. Thank you, and I look forward to any questions you might have.
Thank you, Mr. Keating. I'd like to now yield to Mr. Lukemeyer, so he may introduce our next witness. Mr. Lukemeyer.
Thank you, Mr. Chairman. It's my honor this afternoon to introduce our next witness, which is Steve Herman. He's from our district. He is founder of Supermarket Solutions and vice president of Paul's Supermarket Incorporated. He's one of the only locally family-owned supermarkets in the area, and he expanded to 3 different locations in central Missouri with 75 full-time employees and 100 part-time and seasonal employees. Like so many other employers in my district, the Affordable Care Act and its new definition of full-time employees is greatly affecting Mr. Herman's ability to grow the business and employ more workers. Proud to introduce him this afternoon. I look forward to his comments with regards to how the ACA is affecting his small business. Welcome.
Good morning, Chairman Collins and members of the subcommittee. Thank you for that kind introduction and for the opportunity to testify on behalf of the National Grocers Association on an issue that is very important to independent grocers and small businesses across the country. NGA is a national trade association representing the retailers and wholesalers that comprise the independent channel of the supermarket industry. Independent grocers account for approximately 1/4 of the total U.S. supermarket industry, with nearly $130 billion in sales and over 944,000 in direct jobs that pay over $30 billion in wages. My name is Stephen Herman, and I am Vice President of Paul's Supermarket. Our family-owned company has been in business in Eldon, Missouri for over 45 years. I started working in my family's supermarket when I was 14 years old, learning the trade from my grandfather and father. Like many independent grocers, I fell in love with the business early on and quickly gained an appreciation for hard work and customer service. Today, my family operates 3 supermarkets in Missouri: Lake Ozark, Eldon, and Osage Beach. Like many small employers across the country, we have weathered many economic storms throughout the years and are proud we have never lost sight of the 2 most important things in our business: our customers and our employees. However, we are facing a challenge in our workforce unlike any we've seen before. I am fearful that the unintended consequences of the Affordable Care Act will hurt our employees and undermine our values as a family-owned small business. Under the ACA, the definition of full-time employees has created new barriers for our industry, where working an average of 30 hours per week is simply not considered full-time. The supermarket industry employs a large number of part-time workers to help meet the ever-changing needs and demands of our customers, which can change from day to day. The ACA created new hurdles for businesses by greatly expanding the number of employees eligible for health plans by defining a full-time employee as an employee who has averaged at least 30 hours of service per week over the course of a month. This new definition of full-time will force small businesses to rethink how they hire and schedule part-time employees. Employers are likely to hire fewer employees, especially full-time employees, learning to do more with fewer in order to control costs. Not only is the law redefining what it means to be a full-time worker in this country, but it's permanently changing the American workforce by interfering with part-time workers' ability to earn a living. Part-time employees in need of additional money may no longer be able to pick up an additional shift to pay for unexpected expenditures or earn extra money around the holidays. We employ a large number of part-time associates, many during our busy summer season, but also others that help staff our store throughout the year. These part-time workers include kids working while attending college, spouses helping to supplement their family's main income, and older associates supplementing their retirement. Unfortunately, many businesses may now be unable to provide part-time associates with the hours they need. We've long felt that our associates are like family, which is why we are proud to offer a wide range of great benefits to our full-time associates, including funding 100% of the health care premium after the deductible is met. Our associates have access to a health savings account, and the company contributes a small monthly stipend toward that account. Today, we currently employ 75 full-time associates and 100 part-time and seasonal workers between our 3 stores. We are proud of the fact that nearly all of our full-time associates participate in our health plan, and it is our hope that we can continue to provide quality benefits in the future, although it gets increasingly difficult each year. The commitment to our associates is not without significant cost, especially for a small family-owned business such as mine. Over the years, as healthcare costs have increased, we have worked hard to maintain the benefits we offer, including adapting our health plan to meet the changing times and employees' needs. In this year alone, healthcare costs for my company exceeded $300,000, not including any in-house administration, and we are on track for a significant increase again next year. The supermarket industry operates on razor-thin profit margins, where net profit before taxes among independent grocers hovers around a mere 1.65%. In this competitive industry, pennies really do count and can make the difference between making a profit or not. According to the NDA industry survey, 92% of respondents indicated they currently offer health benefits to their full-time employees, which is a testament to the commitment that independent grocers have to their associates. Employers, such as myself, very much want to continue providing quality benefits to our full-time employees, recognizing that a healthy employee is a productive employee. However, many businesses simply cannot afford to provide coverage to workers who average 30 hours per week. Thus, small business owners will have to make tough choices, and many part-time employees will face reduced hours and smaller paychecks. Independent grocers need the flexibility to be able to manage their businesses and workers' forces to meet the needs and demands of their customers. The burdens placed on our business by this law hamper our ability to do just that and make it more difficult to succeed in a hyper-competitive marketplace. Paul's Supermarket prides itself on supporting charitable organizations and community groups. However, pressures from the healthcare law could impact our ability to continue that support at the same level. My strong recommendation to you today is that Congress should do all it can to help businesses by removing any barriers or any artificial thresholds that will inhibit our ability to hire workers and create good jobs. One of the most effective ways for Congress to do that is to pass legislation that amends the unrealistic definition of a full-time employee under the healthcare law so that businesses can focus on continuing to be an employer of choice in the communities we serve. Thank you so much for the opportunity to appear before the committee today. I look forward to answering any questions that you all may have. Thank you.
Thank you, Mr. Herman. Our next witness is Stephen Bianco. He is the owner and president of 42 Holdings, LLC, which maintains its headquarters in Fairfield, New Jersey. Mr. Bianco operates a number of College Hunks Moving Junk franchise operations in various states. Very catchy name there. These businesses employ a large number of full-time and part-time college hunks, right? He is testifying today on behalf of the International Franchise Association. Mr. Bianco, thank you, and we look forward to your testimony.
Thank you. And although I may no longer be a hunk, my mother does think I am, so that's all that counts. Chairman Collins, Ranking Member Hahn, and members of the subcommittee, thank you for inviting me here today to testify on the effects of the health care law's new definition of full-time employee. My name is Stephen Bianco. I'm the president of 42 Holdings. I'm a member of the International Franchise Association. I'm a former cadet at the United States Air Force Academy and a former trooper with the New Jersey State Police. I own and operate an interstate and intrastate moving company, and I also own 15 franchises of College Hunks Hauling Junk and College Hunks Moving throughout northern New Jersey, Nashville, Tennessee, and Cleveland, Ohio. College Hunks Hauling Junk and College Hunks Moving offer residential and household moves, office relocations, junk removal, donation pickups, and labor services. I'm a proud business owner. It offers a service that my communities need, flexibility, and secure jobs for dozens of motivated team members in multiple states throughout this country. As a franchise small business owner, my livelihood and my ability to provide for my team members depends upon the economy and the strength of federal policies. While well-intentioned, the Affordable Care Act poses a serious threat to my business's ability to continue providing a fun, enthusiastic work atmosphere and quality jobs for people who want them and deserve them. For decades, U.S. employers have used a 40-hour work week as a standard for workforce culture. Unfortunately, the Affordable Care Act's provision requiring employers to provide coverage to full-time employees and defining full-time as 30 hours will cause many employers like me to simply alter the employee's hours in order to run a successful small business. This puts all of us at a loss. Employers must implement new workforce management methods, and some team members will receive fewer hours and reduced take-home pay. Not to mention, they will still be ineligible for employer-sponsored health coverage. I currently have 72 employees in 3 short years. 20 of those are part-time. In 2014, we're planning on hiring an additional 34 part-time workers throughout my locations. Many of these part-time workers work 3 days a week. It's simple, but 3 days a week, 10 to 12-hour shifts daily. These part-time workers are attracted to our company culture because the positions offered can easily fit with their schedules, whether that includes school, child care coverage, or something else within their family needs. During move season, what our industry considers the busy time, we typically have a large number of customers who are trying to schedule their family's move. I'm sure all of you have gone through that. Many of my part-time team members will try to fit as many as 5 shifts in during that time to make additional income for themselves and their families. Currently, it is not uncommon for a part-time team member who normally works 25 to 30 hours per week to double their work hours during that time period to 50 or 60 to make that extra money. I currently offer health plan coverage to our full-time team members. But in order to manage our health costs, I will need to limit the hours worked by our part-time team members. I've offered my full-time team members health coverage even without the employer mandate, and I have every intention on continuing that coverage. However, the increased cost of doing business by providing coverage to employees with fluctuating schedules that only occasionally put them in full-time status will leave me no choice but to scale back my part-time workers' hours. I consider myself lucky because I have succeeded with an ambitious growth plan over the last 3 years. But many small business owners have not. Not only has the employer mandate discouraged job creation and business expansion, it also has damaged existing jobs by including a misguided statutory requirement that discarded more than a half a century of established labor policy by now defining full-time as 30 hours. Culture is everything in a small business. Without a doubt, the one-year delay of the employer mandate is an important reprieve for franchise small businesses as they prepare for ACA implementation. Unfortunately, it is a short-lived solution. The 30-hour definition is a major change that could have far-reaching consequences we have not yet begun to see. The revision of the new definition of full-time employee for the purpose of the Affordable Care Act is a common-sense solution that will put the ACA in line with many other federal wage hour regulations. Thank you for allowing me to testify today. I look forward to answering you any questions. And as a citizen, I am open to conversation.
Thank you, Mr. Bianco. I'd like to now yield to Ranking Member Hahn so she could introduce our last witness.
Thank you, Mr. Chairman. It's my pleasure to introduce Mr. Dean Baker, the co-director of the Center for Economic and Policy Research. Mr. Baker previously worked as a senior economist at the Economic Policy Institute and served as a consultant for the World Bank and the Joint Economic Committee. Welcome, Mr. Baker.
Thank you. Thank you, Ranking Member Hahn and Chairman Collins. I appreciate the chance to address the committee. My name is Dean Baker. I'm co-director of the Center for Economic and Policy Research. And here I want to talk about our research I should say, done with my colleague Helena Jorgensen, looking at the impact of the hours of the sanctions, employer sanctions, on employment practices through the first half of 2013, the period prior to when President Obama announced that the sanctions would not go into effect for 2014. So in other words, this was a period when employers had reason to believe that they would be subject to the sanctions based on their employment for 2013. I'll make three main points. First off, I want to talk a little bit about the plausibility of some of the claims that have been made about the ACA and make a point that at least some of them clearly are not plausible. Secondly, I will review the evidence, the analysis that I had done with Dr. Jorgensen. And lastly, I want to say a couple things about what we might imagine to be the long-term impacts of this particular aspect, the 30-hour requirement in the ACA. On the first point, plausibility of some claims, there have been a lot of claims about how the ACA would cause different problems, how it's responsible for the downturn, the weakness of the recovery. It's important to point out that the first time you really have a direct impact of the ACA on employment is in 2013. There are many people claiming that businesses were deterred from making hires in 2010, 2011, 2012. It's very difficult to see that as credible if you look at the way the labor force behaves. Specifically, we have an enormous amount of churning in our labor force. An average month, we have roughly 4 million people leave their job, a bit less than 3% of the workforce. The idea that an employer would not hire someone in 2011, 2012, because they were worried they'd be, say, over the 50-person limit come 2013, that really is implausible given the normal churning of the labor market. It's extremely likely that an employer would even need to lay someone off, much less, simply not replace someone who was hired. So that part really just is not very plausible. Secondly, just in terms of the impact of this employer sanction, I know no employer, I'm an employer myself, you don't want to be stuck with an additional bill, but just in terms of some context, it's a $2,000 sanction. There's a lot of research on the impact of minimum wage increases of 15 to 20%, the vast majority of which finds little or no employment effect. It's a little hard to believe that an employer sanction that would be less than 10% of the pay of a worker who earns $10 an hour, a full-time job, would have that large an employment effect. So I simply don't think some of these claims on the face are very plausible. Now, in terms of the evidence, Dr. Jorgensen and I looked at the current population survey, which is the most commonly used survey for looking at the labor market. This is where we get our employment data every month. We didn't get this month because of the shutdown, but this is where we get the jobs numbers that everyone hears about every month. And we looked at the percentage of workers who we focused on originally 26 to 29 hours a week, with the idea that you'd have a lot of employers put people just below the cutoff. Now, it turns out we did find a very small increase in the percent who were working in that 26 to 29 hour range in 2013 compared to 2012. It went from 61/100% of the labor force to 64/100%. Now, we might originally think that that might confirm the story that workers are having their hours shortened, but we looked at it more closely, and it turns out that actually that increase came at the expense of workers working less than 25 hours a week or reporting that their hours varied. The number of workers who were working 35 hours a week or more in 2013 was actually a larger percentage of the workforce than it had been in 2012. So in other words, our data is showing the complete opposite of the story. I won't say there was a big increase in full-time employment, but it goes the wrong direction for the change that the critics of the ACA have raised. Now, the last point I wanted to raise is simply talking a little bit about the longer-term story. When you put a specific cutoff, a 30-hour cutoff, whatever it might be, you have to imagine over time employers will respond to that. And there actually is an interesting example to look at. Hawaii has had an employer mandate on health insurance for about 30 years. There's been some research on the effect. In that case, the cutoff is 20 hours. The research found that it did have, after a long period of time, a very modest effect. For the bottom quintile of the pay scale, it reduced full-time employment, or I should say employment above this 20-hour cutoff, by roughly 3.5%, or for the total workforce, roughly 0.7%. Now, before anyone runs off assuming that that's a very bad thing, important to keep in mind the vast majority of workers who work part-time do so voluntarily. That's true even today, where more than two-thirds are working part-time voluntarily. Typically, it would be more than 80%. That's not necessarily a bad thing that we see a small increase in the number of part-time jobs available to people who might be raising children, have other reason not to want full-time employment. And important to keep in mind, there's nothing natural about the length of our work week. That came about in part because we've had a tradition of having health care insurance as a fixed cost for employers, which is likely to make them prefer to work a worker overtime, even paying them time and a half or double time, rather than hiring a second worker. That also is not natural. If we change that by making it more easy for people to get insurance other than through their employer, to my view, that's more consistent with a free market. Thank you for listening.
Thank you, Mr. Baker. At this point, we'll start our questions, and I'll delay mine until the end. Not sure when votes are coming. They may come at 2 o'clock, so we'll get through this as best we can. But at this point, I'd like to yield 5 minutes to Mr. Lukemeyer.
Thank you, Mr. Chairman. Mr. Herman, I want to start with you this afternoon. And what are your plans to try and be able to stay competitive with the chain grocery stores that are in your area? You're a mom and pop shop. And we thank you for that, because as a mom and pop shop, you're a whole lot more engaged and supportive of community activities and much more sensitive to the community than a lot of the chain folks. What are your plans to try and stay competitive with your competition and still be able to maintain the quality of service with the number of folks you have and trying to deal with the 30-hour situation? I know some folks deal with like you've got 3 separate stores. They go to 3 separate organizations, 3 separate corporate entities. Some go with more part-time, some temps, some downsize. What are your plans to be able to maintain your stores and compete?
Well, that's a great question. As a successful business operates, they have to make plans. And one thing we look at first with our existing employees is that they're our family. We're a small community, and we're going to take care of them as best we can. Health insurance is a big deal. Now, what we have to look at is our future hiring practices. We may not be able to hire on someone with the potential of being a full-time employee. We may not replace somebody as, we have to do more with a little less. Another thing, too, tough choices is our part-time employees, we offer 401k after they've been there for a year. We might have to look at, getting rid of 401k, and we have a great 401k program that my father put in place, back in the 90s, and we match 100% up to 5% of gross pay. You look at areas like that, and you mentioned the community. As a small businessman, charitable organizations are huge. It's the people that work with us. I'm fortunate to be on the school board, and we have a town that is a Title I district. It's over 50% free and reduced lunch. There's a program called Buddy Pack, and Buddy Pack, unfortunately, has been defunded through ARA, which is another thing. But where it's been funded from is local businesses and churches in the community. Things like that could potentially suffer. So to hope that helps paint the picture there is what we're looking at. But our existing employees, we want to take care of them, their family. They they used to weigh me on the scale when I was a baby, and they're still there. So it's tough. It's tough, but we wanted to do the best for our community, and that's what we'll do our best to be successful and stay in business.
Well, Mr. Herman and Mr. Bianco, you guys did build it, and we appreciate what you've done. Mr. Bianco, would you like to answer the same question about how you're going to try and maintain your competitive edge with this Affordable Care Act trying to squeeze the hours of some of your employees? I know you've got kind of a unique situation there, that a lot of seasonal and part-time employees. Are you going to wind up cutting back some of those hours on some of those part-time folks so you can put more part-time people in there, or what's your plans?
Our competitive advantage is just that. It's us trying to actually change an industry in the moving world. And that's been our mission from day one, is to be a true change agent in that industry. What we are trying to do is offer opportunities for young individuals to get their career start, not just a job start with our organization, and have each individual work on the trucks, even as young college graduates, to begin their process in their career on our vehicles in the moving world and in the hauling world. With that, we do have a lot of them as part-time workers. If we have to reduce those types of hours that drastically, those quality high-end individuals that we are striving to hire will not be interested in working with us. That prevents us from growing. Our expansion growths and expansion opportunities in 2014 are taking on 3 other cities to provide our services and our job opportunities in 3 other cities throughout this country. It may affect that growth strategy because of the amount of part-time workers we hire in the beginning. With that, will have us draw back on those part-time employees.
You know, one of the things that Mr. Baker said a minute ago, that 2/3 of the people who work part-time want to do that. That means 1/3 of the people are working part-time who don't want to do that. And I think that's the tragedy, and that's the point that we forget about, is those folks who are out there who want to work full-time and can't do that. And this bill is going to force a lot of that to happen. Mr. Bianco, you had a unique comment a minute ago. You said culture is everything, culture is everything in a small business. Would you like to elaborate on that just a second?
You know, sometimes in a small business, when you are starting out, you do not have the ability to pay the highest wages. And I've always been a believer that it's not about the wages you're paying the employees. It's about the culture and the opportunity you present for them. So our environment is all about culture. It's about providing an opportunity for our employees, for our team members to get a start, to create a vision for them, to give them an opportunity. Many of our employees come as college graduates. However, they've never been given the backing and opportunity for someone to say, you know what, you have an opportunity to create something out of your life. And we find a lot of them, even with 4-year college degrees, that have absolutely no idea where they want to be when they grow up. We've created a culture that drives them to success. I've always believed in success breeds success. And when you have other successful people around you that are striving and aiming for that same goal, it attracts more and better people. So when I say culture is everything, especially when you are 3 years in a startup and having a high amount of demand on a lot of people and not fully capable of paying the higher wages at this point in time, if you don't have culture, you die.
Unique to a small business. Thank you very much for your time this morning, gentlemen, this afternoon, and I appreciate your testimony. With that, I yield back, Mr. Chairman.
Thank you, Mr. Lukemeyer. At this point, I'd like to yield to Ms. Hahn for her opening questions.
Thank you, Mr. Chairman. I'm going to do the same thing that you did, and I'm going to leave my questions till the end and turn it over to my members. And the first one I would like to yield to is the ranking member of our Small Business Committee, Ms. Velasquez.
Thank you. Thank you, Mr. Chairman, for yielding. Mr. Baker, if there is any empirical evidence that 1/3 of part-time workers are working part-time as a consequence of the ACA?
No, absolutely not. You know, the reason there was a big increase in involuntary part-time employment was we had the downturn. That happens every downturn. This downturn, of course, was much more severe. It was a very different sort of downturn. We had a collapse of a housing bubble caused it. It was an extraordinary crisis. I'm sure I don't have to tell people about it here. People remember this. And that led to a large increase in part-time, involuntary part-time employment. And that has been falling, you know, over the last 4 years as the economy slowly recovered. So the rise in part-time employment predated even the passage, much less any implementation of the ACA.
And basically, your numbers concurred with the Federal Reserve Bank of San Francisco that found and concluded in their research that the share working part-time is in line with historical norms, and concluded that part-time work in not usually high relative to levels seen after the 1980s recession.
That's exactly right. So other people, they've looked at it. There's another study which I can't place offhand, but I know of no studies that found an opposite conclusion. Basically, every study I know that's looked at the data has found that involuntary part-time has followed the same sort of pattern that you would expect to see given the weakness of the economy.
Also, there has been 2 recent surveys conducted among small businesses, and one of them is from NFIB. And they found that the biggest obstacle reported by businesses were economic uncertainty and consumer demand. Wouldn't these factors play more of a role in an employer's hiring decisions rather than implementation of ACA?
Absolutely. And the NFIB survey in particular I recommend to people because that dates back to the 1980s, so we have reliable data going back for close to 3 decades now. And they ask the same question to employers. I don't know if they've never changed it, but basically a similar question over that period. What are the biggest problems they face? And they've consistently answered during this downturn a lack of demand. So clearly that's their main obstacle to expanding.
So meaning that hiring practices or decisions will be driven by economic uncertainty, the impact of sequestration, and the lack of consumer demand.
That's right. Anything that slows the economy, anything that pulls money out of the economy, sequestration being one of the things that pulls money out of the economy. We had a reference earlier from Mr. Keating to comparing this recovery to past recoveries. One important thing to consider, past recoveries, every prior recovery, we've had a significant growth in government employment, mostly at state and local levels, throughout the recovery. If we had followed the pattern of prior recoveries, we'd have roughly 700,000 or 800,000 more government employees than we did at the start of the recession. Instead, we have about 600,000 or 700,000 less. Now, government employees spend money like everyone else does, so if you get rid of government employees, that's less demand in the economy. That's clearly one of the factors. I'm not going to say the major factor, but it's one of the factors slowing growth, slowing employment.
We have held hearings in this committee, and I held a roundtable in my district with the manufacturing sector. And what we hear is that they face a shortage of workforce, of skilled workers. And don't you think that a way to manufacturers and business owners be able to bring in high-skilled workers is by offering health care benefits?
Absolutely, and I think my colleagues on this panel made that point very well. They know workers value health care benefits, and if you can offer a good health care benefit, that makes the job more attractive to employees. So that's why most employers, most large employers certainly, and in fact most small employers, offer health care benefits to their workers.
Mr. Keating, in your written testimony, you say that the health law for you blame the Affordable Care Act for reducing job growth and employment in 2010 through 2012. Yet the sanctions impacting employers were not scheduled to be in full effect until 2014, and now the employer mandate has been delayed. Since 4 million people leave their job every month, is it really plausible that a business wouldn't want to hire someone in 2011 or 2012 because they were afraid of the penalty in 2014?
Sorry, okay.
Yeah.
Yes, of course it's plausible because actually businesses and entrepreneurs plan, unbeknownst to what we heard earlier. When you run a business, you have to figure out what your costs are today, and you have to figure out what your costs are a year from now and try to estimate going out. So when you have a law that's passed in 2010 that has looming mandates and regulations and so on and tax increases, that's certainly going to impact the decisions that business owners make. That's just the reality of the business world. Incentives come into play. I was glad to hear people talking about incentives before as an economist. I try to hammer that home with my students. Incentives matter. Economics ultimately is about incentives. So yes, when you put the Obamacare bill in with everything else, I mentioned at the end of my testimony that it's part of an unfortunate policy agenda that has been pointed against faster economic growth and more job creation. We would want to, as we've seen in past, What's the best answer to to coming out of a recession and growing an economy? It's not tax increases and more regulations on businesses and entrepreneurs and investors. That's exactly what we've done. So I would say that this is very much part of the equation, yes.
Yeah, it could be, and also the lack of demand.
Yeah, well, I'm glad you touched on that, right?
That
we can't take the economy as just being, well, it's bad, so therefore we just have to deal with it. The question is, why is it bad? Why did we have such a deep recession, and why are we now, over 4 years into a recovery, having one of the worst recoveries on record? Now, there's a lot of debate about that. I'm sure Mr. Baker and I would disagree, but I would say a huge part of it, in fact, I would argue the biggest part of it today that's holding us back is this policy agenda that is pointed in an anti-growth direction.
Mr. Baker, would you like to comment?
Yeah, well, first off, in terms of businesses planning, of course they do, and presumably businesses know that their employees turn over. So if they were worried in 2010, 2011 that they're making hires that if, put them over the limit for 2013, if they're doing good planning, they know that they can count on some of their workers leaving. So that really wouldn't make a lot of sense. In terms, again, the downturn, I've written on this at length, as have others. We had a collapse of the housing bubble that was driving the economy, and none of us has a magic elixir to simply replace that. And this is a qualitatively different recession. Some of us said that at the time. We warned of the housing bubble. It was easy to predict, or at least I thought it was easy to predict. So there are no surprises to me. It's really followed pretty much the textbook. So, and if we look at business investment, which is, if this really is the case, that's actually pretty much back to the pre-recession levels. So unless we know something George W. Bush was doing that was very anti-business back in 2007, it's hard to see anything Barack Obama is doing because it's having no more effect.
And on top of that, the housing bubble and the impact of sequestration on an economy that's still struggling?
Well, again, we need every source of demand we can get, and government demand is just like any other source of demand. If we cut back government spending, cut back government employment, we're pulling out a source of demand for the economy. So that certainly slows growth. And again, in terms of the housing bubble, we're not going to replace that, at least not in any easy way that I could see. And, and frankly, I wouldn't want it to be replaced by another housing bubble. That would not be the way to go. But we can't just, I don't know of any magic elixir that just says, okay, we'll replace that source of demand, which, again, by my calculation, somewhere around $1 trillion a year in lost demand.
Thank you, Ms. Velasquez. Shall we yield back?
Thank you. At this point, I'd like to yield to Mr. Rice. 5 minutes.
I'm sitting here looking at a Forbes poll. When asked, will Obamacare make health insurance more affordable, 69% said no. Online poll, 78% of small business owners think the law should be repealed. 93% do not want to change from their current plan to the plans required under Obamacare. And I want to read to you a little excerpt from a constituent that I got just yesterday, or excuse me, the day before. This fella is in the steel business. I'm going to redact his name, and obviously he has to compete internationally. And I know that when you're talking about competition, some of you guys in the grocery store business and the moving business are competing domestically, but not necessarily with international competition. And so I was really interested in, I'm very concerned about American competitiveness. And I think that a lot of our government's policies make, American business can compete with anybody across the world, and our workers sure can. But our government hamstrings us with uncompetitive tax system, uncompetitive regulatory environment. And so he's talking about how it affects his business. And he says, we're already fighting for our lives against the Chinese, whose government is helping them to compete with various subsidies and tax breaks. At the same time, our government is adding to our cost, not helping us to reduce cost. It's obvious what this does for jobs in this country. And he goes on to say that the increase, he's got 90 employees, the increase in the health insurance will be about $100,000 for 2014 over 2013, and that he currently buys policies from Blue Cross Blue Shield, who's decided they're no longer going to sell the type of policy that it has anymore, I guess because they can't under the minimum required coverages under Obamacare. So I guess, Mr. Keating, going beyond this part-time worker aspect, does this law make our domestic companies more or less competitive in the world?
Bottom line, it makes them less competitive just due to the costs. Again, you cited polls, and poll after poll confirms what kind of Economics 101 teaches us, that if you add government costs, whether through taxes or regulations or so on, onto businesses, they're going to become less competitive, obviously. And when you think about what our economy is like today in terms of the international marketplace, I think it's a real serious impediment. The gentleman that I spoke to yesterday, who has a small manufacturing firm in Wisconsin, he's just not a domestic firm. He sells the parts that he makes for all sorts of machinery globally. So he's very much involved in that international competition. And he is, when he looks at the premium increases that he's calculating, that puts him at a serious competitive disadvantage. Absolutely.
All right. Mr. Baker, in terms of the plausibility of people making hiring decisions today based on a law that the employer mandate won't go into effect until next year, I've had people in my office. I had a guy in my office 2 weeks ago who has a franchise business in 2 locations and 40 employees, and he has declined to open his third because he'll go over 50 employees. So he's making a decision today based on opening a business that will affect potential employees. It's absolutely plausible that people are going to make decisions based on this right now. I have a friend and a former client that is in the, I'm from Myrtle Beach, South Carolina, in the tourism business, employing 1,900 people. And they're absolutely moving people from full-time to part-time when this law takes effect. They haven't done it yet because the law hasn't taken effect yet. But no, it will absolutely have an effect on the service economy in my area. Do you want to comment on that?
Sure. Thank you for asking. Well, a couple points I make. First off, I'm sure there are some people who are making decisions, based on this, and the gentleman you were talking about, that may well be one of them. It's clearly not showing up in the data for the first 6 months of 2013 when they thought the employer sanctions would be in effect. So in aggregate, however many people might have been doing that, it was too small to show up in the data. Now, in terms of the moving people from part-time to full-time to part-time over a longer term, I would be surprised if there's not some of that going on. But again, the point I was trying to make, and perhaps I didn't make it clearly, we have a lot of people in this country who choose part-time employment. So the fact that you might have some employers that are offering part-time work that would actually be consistent with what many people desire. So this isn't something I would expect to see overnight. I would expect it to see, in the case of Hawaii, it didn't even show up after 10 years. It was only after 20 years that it was visible in the data.
One more quick thing. In the Budget Committee, I asked Doug Elmendorf, who's the head of the CBO, what his estimate of job loss from Obamacare was, and he said the CBO's estimate is 800,000 full-time jobs lost as a result of implementation of this law.
My understanding of Dr. Elmendorf's comment was that that was mostly people opting not to work because they would have the option of getting health care through the exchanges rather than through employer-provided health insurance.
Thank you. Unfortunately, it does look, votes have been called, and we have a number of members that still have questions to go. So what we're going to do is adjourn. It's a quick 2-series vote, so I'm guessing we'll be back in less than 30 minutes. Unfortunately, where you see 11 minutes now, you can add about 10 to that because they always hold over that first vote. But we should be back in about a half hour, at which point we'll adjourn for right now for about 30 minutes and reconvene after the votes. Okay. The meeting will come back to order. Let's see. Well, it was a little more than 30 minutes, but at any rate, we are back, and I appreciate the witnesses all coming back. And at this point in time, I guess I'll yield myself time for some questions, and then we'll go to Ms. Hahn and see if any other members come back. But typically, when we adjourn to vote,
the important members come back.
That's right. Yes. Yeah. Thank you, Mr. Lukemeyer. I guess I'm a small business owner. I've been an entrepreneur for 40 years, so I know what's going on. But I've also, in this role, I can remember asking the director of the IRS in charge of implementing the laws. I asked him a couple of questions. So I'm just curious if Mr. Bianco or Mr. Herman could even answer these, because as we're preparing for the employer mandate, and while the penalty's been delayed, the mandate has not been delayed. That's been misspoken time and again. I hear people, both sides of the aisle, of the administration, saying the employer mandate has been delayed 1 year. No, it has not. The penalty associated has been delayed. The other thing to point out to everyone is that when you try to determine who qualifies and whether your company qualifies on the 50-employee level, it's the 12 months that precede the year. So now, relative to being charged with the penalty, the buckets or the measurement starts January, so in less than 3 months. So when people talk about impact, starting in January, you've got to put all your employees into the part-time or full-time bucket and calculate the hours and the full-time equivalents. You do that each month for 12 months during 2014, and then divide by 12 to determine whether or not in 2015 you hit the 50-employee threshold. So I know I said to, I asked the head of the IRS, and we submitted them questions, and I was promised a prompt response, and I guess I'm still waiting, and that was several months ago. But I said, Mr. Director, and I'm asking, well, for 5 or 6 days, but not 2 months. But so as small business owners, here was the question. Full-time employee, who would say normally work 40 hours a week, so 160, 170 hours a month, takes 2 weeks vacation. So he only works 80 hours in August. Is he full-time or part-time in the month of August? Would either of you know an answer to that?
I believe that'd be under your benefit plan. In our business, we have paid vacation up to 4 weeks.
But I'm saying relative to the IRS calculation of which bucket you put him in. He only worked 80 hours. He was paid for 160, but do you put him that month in the part-time bucket, because he only worked 80, and you count his 80 hours to do your FTE equivalent, or because it was paid, does he go in the full-time bucket? The head of the IRS couldn't answer that question, but he does expect you to know exactly which one to put in. Now, the other one I asked him, and again, I know it's difficult, but this burden is falling on to the small business owners and their HR departments. Many workers might in any 1 month work over 130 hours, even if they're part-time based on overtime and so forth. But then the next month they don't. So they work 135 hours in January, they work 97 in February, they work 161 in March, they work 82 in April. Well, you know how you put them in the buckets each month. If it's over 130, they go in the full-time bucket. If it's less, you accumulate their hours, divide by 130, get the FTEs. But now you're into 2015. They worked 6 months, and they were in the full-time bucket the prior year, and for 6 months they were in the part-time bucket. Do you have to give them health insurance or not? So these are very, this is the tough thing about the law. When the regulators set definitions, it's how do you implement it? And I'll say, as we're in October, and in the next and by the way, the mandate has not been delayed, just the enforcement of the penalty. The head of the IRS, who is in charge of implementation, can't answer those questions. So again, it tells you this isn't ready for prime time. I just bring that up as I'm a small business owner myself. And we have those very situations. And we don't know as we're going to be putting them in the buckets. And I guess the other obvious thing is, we'll see what happens as we move through. But a question maybe for Mr. Keating, because I've heard people talk about why 30 hours? Where'd it come from? It's never been there before. This suggestion has been twofold. One was, we'll have small businesses just provide health insurance to more people. The other, more cynical one is, it was a money grab, that knowing that this would subject them to penalties, it was a way of raising money to pay for the expansion of Medicaid, or maybe it's a little of both. I'm just wondering, Mr. Keating, if you've got a thought on that.
That goes to my public choice economics as to what the incentives are in government. And just based on that, I would say it's probably a combination of all of the above. And to backtrack a little bit, when I get to speak on various panels about this law from an economist perspective, and interestingly, often there are representatives from the SBA or various government entities, and most of the audience are obviously small business owners struggling to figure this out, and they have very pointed questions about what this means for their business, and I would say at least more than half the time, the people from the government that are there representing it don't have the answers. And that says to the business owners, what? The folks implementing this don't know. How am I supposed to possibly figure this out? And then it goes to the issue of how many employees you have to, how much time and energy goes into trying to figure this out. When, I talked about my testimony, we would hopefully want the time and energy and resources going to something productive in terms of expanding the business and creating jobs.
Right, and I think that goes back to the human resource cost. So, Mr. Herman, you're here not only representing yourself, but also other franchised owners, or is that Mr. Bianco? So the question is, I know a lot of franchisees have lots of part-time workers, and by and large, from what I've been told, those workers didn't sign up or didn't come in looking for health care. They were there to supplement their income, if you will, and many of them were working 37.5 hours and have now, in fact, had their hours cut to 28, 27, and I just wonder, because I know Mr. Baker was saying that the data doesn't show it, but then again, the data always lags. Are other franchisees, sharing with you, as I've heard from many, that they in fact are taking action to cut those workers under 30 hours?
Yeah, so Mr. Collins, if I can first comment on your previous question regarding the new laws and regulations and the controversy that it causes for a small business owner. If the IRS can't figure out what to do or to get back to you on it, a small business owner, as you know, your time needs to be spent on the growth of your business, not trying to figure out laws and regulations. Each and every second that you detract from your core business value is a decrease in revenue and decrease in growth. So I wanted to make a point on that we don't have the time and the opportunity to spend it on trying to figure out new regulations that are uncustomary to what we currently have. We have seen multiple franchisees, and the ones I have spoken to myself, that have decreased the hours or are planning on decreasing the hours on their part-time employees. One of the biggest things about being a small business owner is that you have to plan 3 to 5 years in advance. If you're not doing that planning, no one else is doing that planning for you as the business owner. You need to be looking out for where your business, where your employees are going to be in 3 years, not just 1 or 6 months. So you have to take into account when you're doing your budgeting in 2013, as we're going through right now, we are not planning for 13. We're planning for 15, 16, and 17. And we're taking into account what is going to come ahead of us. So it's not just about hiring new employees. We plan on having those employees. Those employees may change, but the system and the mandates don't change. So we need to take that into account and know that we are going to have X amount of additional employees. We need to be able to properly fund those employees and plan for them.
Another quick question for Mr. Bianco. I know a lot of companies had health insurance plans that they and their employees thought were designed very well for their business from a cost perspective and so forth. In many, from what I'm hearing, those plans are no longer available, unlike when the President said, if you like your health care plan, you can keep it. Well, you can't keep it if it's not offered anymore. So I'm just curious of your college hunks, how many of them needed maternity care?
0.
Okay. And I have to assume, how many really needed prescription drug coverage?
That varies. And the reason that varies is a issue that I talk to them about on a consistent basis. I want them to care about themselves, and I want them to care about their health. I don't want them just to go because they have an opportunity to take a plan, and that's an open door for them to look for, or each and every ailment they might have, to go search out for prescription medication. I want them to know how to take care of themselves and become healthy individuals and not just rely on something. So we've actually had that conversation in our, what we call our all-staff meetings that we have each month, where we either bring guest speakers or have internal conversations. And the last conversation I had with them was based around taking care of themselves is their best opportunity to lower any cost that they may have. So it does vary between the individuals, but inside our system, we are trying to cut back on that as much as possible.
Yeah, so Mr. Herman, I'm curious from the policies that you've had versus now the policies you're being offered, which now have to include maternity care, they have to include mental health, they have to include prescription drug coverage, a health club membership. There are things now that are mandated, and not every workforce is looking for those benefits. And now the day of an owner designing a health care plan to meet the needs of their employees has now been taken out into more of a one-size-fits-all. So I'm curious, Mr. Herman, plans that you've offered for your employees, are they being offered now, or if you had to adjust now to the minimum benefit plan that's required by the ACA?
Well, we've been blessed to offer our employees a robust plan, and our plan already met the requirements of ACA. So what we have done, though, is how are we going to control our costs? And we're having to get inventive on that and look at new ways to handle it. And potentially means us as a company taking on more risk in order to manage those costs. And what we've done is gone to a captive. And a captive is a sort of reinsurance program that allows smaller businesses to go out and group with other businesses. And but that's more risk. I mean, we're taking a risk, as with anything. And health insurance is not about, when you buy it, you're not supposed to be taking a risk. But this forces us to go out there and take these risks. The hope that we manage it, but we're going to take on our own shoulders, meaning more administration costs. And so it puts us in a, the health insurance is supposed to be a benefit. And as a small employer, I'm supposed to be able to go to somebody and get insurance and not have to worry about it. And this has put us in a predicament that we've got to also understand the health insurance law beyond what we need to.
Thank you. Mr. Keating, one last question, then I'll turn it over to Ms. Hahn. But, one question that's been raised, and I wonder if you've heard this before, and that is, take the case of a company that has employees working 37 and a half hours. They did not go to work there for health insurance, did not expect health insurance, but now they would be, the company would be required, because they're full-time, to offer it or pay that $2,000 penalty. So the company cuts them very deliberately from 37 and a half to, say, 28. For the sole purpose, frankly, of avoiding having to pay that, provide that health plan. The employee wants to work 37 and a half. The company would like them to work 37 and a half. They can't afford to give them at a donut shop health care, and they also can't afford a $2,000 penalty. So this is very real life, and I'm actually using a real life example. But now, lo and behold, there's laws called ERISA. And ERISA states very specifically, if a company cuts the hours of a worker for the sole purpose of denying a benefit, then they can be fined and brought up on charges. That's what ERISA states. So you think about this case. The employee's not getting health insurance now, didn't expect it, doesn't want it. It is true, though. The sole reason that their hours are being cut is to avoid giving them a benefit. Now, to me, they're violating ERISA. In complying with the ACA to the extent of keeping their business open because they can't afford the insurance or $2,000, has anyone looked at that? I'll call it a conflict or a very serious situation of a company actually breaking the law in complying with the ACA.
I have not looked at it myself, and I haven't heard of that particular example, but it goes along with other examples, talking, again, to business owners and listening. They're getting, I always tell people, listen, what you need to do is, unfortunately, get a good accountant, get a lawyer, and figure this out. But make sure you're getting the right advice, because the very disheartening situation, in addition to what you just laid out, are other business owners that have made decisions, splitting their companies, thinking that they could do that, and you can't do that under the law. Yet they're getting advice from the people they're doling out money to get advice from people, and this is the advice that they're getting. So that, unfortunately, is not unique in the sense that, again, who really has a handle on all of these issues and all of the costs? And this creates, obviously, all the uncertainty that we've been talking about for a long time now.
Yeah, I think a couple of things that are misunderstood. You can't split your companies. You also can't use temporary workers. A lot of folks have said, well, I'll go hire temporary workers. They're not on my payroll. And in that instance, not only do those workers count for the business that's using them, but the person that's running the temporary service agency is also hit with the same thing. So that worker's actually counting in two different companies, as unfair as that sounds. Mr. Lukemeyer, I just didn't know, do you have any other questions you'd like to ask?
Yeah,
if so, we'll yield 5 more minutes to you.
Thank you. Just a couple of quick questions with Mr. Keating. One of the comments that you made, that you're working with the entrepreneurship group, how's this ACA affecting startup companies? Most businesses start out as a small business and then grow to whatever size they get to. Is this affecting a lot of startup companies being able to get started out there? Or have your group done some research on that?
Right. I think the one that people don't think of actually that does come into play is the individual mandate. Because when you talk about somebody starting up their own business, right, now they have to buy their own health insurance or pay the tax that could increase up to, I'm trying to remember the percentage by 2016. But anyway, the point is that, so you do have a situation where people, again, are losing resources that could be used to start up their business, number one. I think beyond that, you've got just this air of uncertainty, questions, costs. What is this going to, if I get this business up and running, what are going to be the costs on the regulatory front in terms of Obamacare? You've got a plan to, as the business owners here have talked about, and I talk about in my MBA courses, is that you have to have a business plan and you have to be realistic with it and lay out where you want to go, and that's from the very startup stage. That's the ideal scenario. So how does that all factor into the equation in terms of what you're going to have to, the total benefits package, if you're looking to hire people and bring them on board, how is that going to affect the equation? So yes, again, I have not seen any studies that say, this is affecting startups in this way. Again, I don't think we have that information yet. But based on, again, good old economics 101 incentives, it's clearly a negative in the equation. And that's what, to just a real quick point, all of the things that we're talking about here, the bottom line is that it's an additional negative. Now, you can debate how much of a negative it is for various businesses, and it's going to range from business to business, but it's a clear negative in the equation in terms of costs for businesses. That's the bottom line. And in this environment, why are we going down this path in the first place is the question.
Well, I think one of the figures that just jumped out at me was the one that in your testimony, and you mentioned a while ago, is 76% of the small businesses are likely not to hire in the next 6 months. And there's other numbers in here with regards to how many are pulling back the number of employees that they have, as well as cutting their hours. That whenever you look at small businesses as being the drivers of our economy, that just immediately shows that there's a blanket of over this entire economy with regards to ability to generate jobs. And, I think you probably could extrapolate from that there's not a whole lot of new job creation going on out there as a result of that, unless there's a particular niche industry of some kind. But
right. Well, the energy industry is great, right? Yay. It's right. When I go out and talk to people, I can talk about the energy industry and how well they're doing. But yes, across the board, again, the numbers are clear in terms of where we should be in terms of job creation during this recovery and where we actually are. You can pick your survey, whether it's the household survey or the establishment survey. We're nowhere near where we should be. So again, I put those surveys in there for a purpose because, again, when you look at the economics of it, we can discuss theory and incentives and so on, but the reality is that when people are going out there and talking to small business owners, this is what they're hearing. Sure, there are going to be the exceptions along the way that think this is great, or maybe their business is growing that it doesn't matter to them. That's fantastic. I would argue that the fact that we've had 2.2% growth with everything that's been working against entrepreneurship and investment is pretty amazing, and I think that's worth tipping the hat to the resiliency of the American business owner and the workers. Absolutely.
Yeah, but I think your point is about the energy industry is probably where the growth has been. If it hadn't been for that, I think my numbers that I've seen would be a flat GDP. But I think the 2.2 is actually as a result of the energy industry that's going gangbusters right now. But
a huge contribution, without a doubt,
yeah.
When you look at both the GDP numbers and the employment numbers, without a doubt.
Just one point I want to make before we close here is that, Mr. Baker made the comment some time ago that the businesses did not make any sort of plans and did not make adjustments prior to 2000 and the beginning of this year in 2013. And I can tell you from the businesses I've visited, or when I go home on the weekends and have district work periods, as well as the people who come through my offices, when you talk to those folks, they have been looking at this ever since it passed on how they're going to comply. They talk with their attorneys, they talk with their accountants, and many of them had made business decisions on not expanding or not hiring additional folks based on this law for a number of years already. And so just because the numbers don't reflect it today, they've already made those decisions in the last year or year before, whenever they decided not to expand, buy new locations, or not to expand existing location. With that, Mr. Chairman, I thank you for the opportunity to be here today and the timeliness of this hearing.
Thank you. At this point, I'd like to yield to Ms. Hahn.
Thank you, Mr. Chairman. Actually, and then I'd like to ask Mr. Baker to respond to some of the comments that Mr. Keating made. But honestly, I really disagree with the comment that being an entrepreneur in this environment with the new Affordable Care Act is a negative. I think just the opposite. I think it's a positive. I think there are a lot of people that get stuck in a job they don't want to be in because of the health insurance that's provided them, and are afraid, and their families are afraid for them to step out and be an entrepreneur. And I think this law allows someone to strike out on their own and be able to afford quality health insurance without jeopardizing their family or themselves. So I look at it as the complete opposite of what you just said. I think it is a positive. I think it is resources now that people never had before, and there are a lot of people who stay with a job just for the health insurance and really have that entrepreneurial spirit inside of them and have been afraid to do so, specifically because of the inability to get health care on their own. And I don't know, Mr. Baker, if you wanted to also respond to some of those comments that Mr. Keating made.
Yeah, well, in particular, I would take up on that point because there has been a considerable amount of economic research showing exactly this, the idea of job lock, that you have people that have a job with health insurance, either they or a family member has an existing condition, and they know if they had to go into the individual market, they would either not be able to get insurance at all or it would be absolutely exorbitant. And I actually was curious about this, clicked onto a few of the exchanges, the state exchanges, and looked at the oldest group, 55 to 64, where you'd, of course, pay the highest premiums. And you could get the silver plans, the middle plans for $600 a month. It varied by state, which plan you chose. But in other words, insurance I would consider very affordable. This is not counting any subsidy. So this is, if you're a more moderate income person, you would get a subsidy on top of that. So, I would just think, I actually do have my own business, my own research center. But, if I were thinking of starting that out today, it would make a big difference to me knowing that if, for whatever reason things went badly and I was not getting insurance through the center, I had the option of getting it through the exchange at an affordable rate. So I would be very surprised if we don't see a burst of entrepreneurship in the next couple of years.
Thank you. That's what I think as well. And, just remind everybody, the health care in this country was broken, and so this is really an attempt to fix what was terribly broken. And actually a national 2008 study by the Small Business Majority said that small business health costs would more than double by 2018 without any reform. So just to kind of remind everybody, health costs were going up. And it was a broken system. So this is an attempt to lower health costs and bring it down. But there are some issues that we're finding out today. And just on the Small Business Majority, I don't know if you have connected with them, Mr. Bianco and Mr. Herman, but I've held several workshops on the Affordable Care Act with small businesses in my district, and the Small Business Majority, and they have offices throughout the country, are really a good resource. When I felt your pain when you said, you don't have the kind of resources to figure this law out, and it is confusing to some extent. But this is a good resource that, they're there for small businesses. They are champions of small business, and they are very good at helping kind of go through the maze on this new health care law. So you guys might check into them. I guess for both of you, it sounds like you have different issues. Mr. Herman, you sounded like you were saying you're taking care of your employees now. You're gonna take care of them. They're like family, but it's more about your you're hesitant to hire more in the future. Mr. Banco, it sounded like for you, you're more concerned about having to offer health insurance for those who are working 30 hours or more. Have you actually calculated those costs of, what it would mean to insure your full-time employees, or those part-time employees that, you talked about those that worked 3 days a week, sometimes 10 to 12 hours, which would push them, to the 36-hour limit?
Sure. If I can first comment on
Yeah.
your previous statement, reference the Affordable Care Act as a whole. Our healthcare system is broken. There's no doubt about it, and we need to make a change. But I think what we're addressing here today is around the 30-hour work week, not so much the actual plan. And so for a individual like myself, we know I want entrepreneurs to have the ability to be able to step out. It's just how it's done and how it's made. I don't think anybody is against individuals being able to have health coverage. I think as Americans, as people, as human beings, no matter what background you come from, you want everybody to be taken care of. And I feel the same exact way. However, it may not be the best system for business entrepreneurs. I think today we're talking about the 30-hour work week. When it comes to us, no, we want nothing more than to provide the health care coverage. That's why we made the step from day one. First day I opened, I provided an opportunity for my very first employee from day one and made that investment, and we continue to make that investments. You made a comment on the cost. It will cost us $2,200 as we have set up per new employee on a part-time basis if it's not changed, reverted back to 40 hours. And now when we look at new locations.
And how many is that for you? How many of those employees fall into that category?
Sure. When we open a new location, with 12 to 13 part-time employees and one full-time employee. Those part-time employees work between 30 and 35 hours a week. When we ramp up a new location, a new city, we march into a new city right away off the bat. We are providing the 15 new opportunities right away. However,
and they're like 36, 35.
They're like 30 to 36
Okay.
hours per week.
You right now don't consider them full-time.
No, they're not full-time.
Right.
And they will grow into full-time positions, and they will receive that benefit from working hard and helping us establish our business. But our business cannot be established if we do not profit. We need that margin. We need every single margin. You talk about 1.6 margins, 5% margins, 15% margin. It doesn't matter what industry you are in and what margins you have based upon your industry. When you are a startup, you need every single percentage point in order to make that business go.
If this doesn't get changed back to the traditional 40-hour work week, what will you do?
We have that additional cost of $2,000.
You will have the additional cost, but you won't.
We will grow a lot slower.
You will grow slower.
With our system, our model, our scale that we have set up currently that has worked tremendously. We went into Nashville, Tennessee, opened up a location there as a franchise. I went in there and I purchased a failing franchise. We grew by over 600% in 1 year with our model and our scale. We know it works. It doesn't work with the additional costs. When we moved into Dallas, Texas, when we opened up in Dallas, Texas on December 16th, with that in mind, if this was in fact currently right now, those costs would prohibit us to grow upon the same scale that we know we are capable of growing upon. When we went into Nashville, we started out with 3 employees. We now have over 30 in 9 short months.
And is that cost calculated on your current insurance provider? They've told you that adding more employees would be at that cost?
Well, that's what I have to go on currently right now, working with our insurance provider. So if we're offering it to the individuals that we're offering to it now, we have to offer it to equally amongst the other employees, and that's the cost burden that we have to take on a part-time basis. And it's not an issue of not wanting to do it. It's an issue of the business will not grow and scale the same exact way without it.
And Mr. Herman, what's your biggest concern?
Biggest concern to get back to is we are taking care of our full-time employees right now. And we did run the numbers and look back on the past 4 weeks, and at 30 hours could bring in about 10 more onto the plan. And at that,
what would that cost you?
That would cost me $36,000 a year, at least. That's just looking at not including administration costs, not including
For 10 more.
For 10 more.
I think he's got a better plan.
You know, well, and here we go. We talk about these plans. They're so diverse.
Yeah.
We're talking apples and oranges here. You know, to have this conversation, and I'm just concerned, like I said, about. So you talk about the budget office. That's still time I got to step out of the store and go down there. When what happened to just shaking my my uncle's hand, who's an insurance agent, and saying thanks for getting us good coverage. I actually have to leave him now. I'm leaving my uncle in the local insurance agency because they don't provide the plan that I think is going to best keep us in business. So the local insurance agent, he's got his hands in the air. He sells this stuff, and he says, I don't know what to do. We don't have a plan for you. I'm sorry. So, you know, I'm concerned about that. That's a local guy that shops in my store. He's got an agency there, has other agents. You know,
I thought your current plan provided the benefits that the
no, to stay competitive for our rates. When I look at our rates on where we're going to go to, his rates we're going to go up 10 to 20% at least. So we had to do something to keep our insurance plan, to keep our costs in line. And as a small insurance agency, they didn't have the ability to look at their underwriters and see what the options they had. Had to go with someone else that was innovative and do something else that hurts a small business guy, and it also drags you out of the office more. You know, spend a lot of time on this. And we had health insurance, and we still are going to provide health insurance to our employees, to our families. But, I mean, spent a lot of time on this. I'm taking time out of my schedule because I believe that the 30-hour requirement can cause some issues. And so I'm here today to comment on those 30 hours and hopefully represent the independent supermarkets across the nation, independent business owners, and make a difference.
Thank you. Well, I appreciate all the witnesses here today. I think we've all learned something.
Yeah, myself as well. I think we heard some divergent opinions. I think, at some point, where do we agree? Uncertainty is not good. Uncertainty in any number of areas, including uncertainty surrounding our deficit and debts and where those are headed. The more entrepreneurs and small business owners have certainty, the more likely they are to invest. And it's interesting, too. I think we're getting consensus agreement in a bipartisan way that whether it's the 30-hour work week, whether it's now the new definition of large business at 50 employees, or whether it's the medical device tax, or whether it's the health insurance tax, all of these revenue drivers that we're going to bring money, the taxes, into the government to pay for this huge expansion Medicaid, in each and every case there's bipartisan agreement they're not good for the economy. Whether it's 30 hours, 50 employees, health insurance tax, medical, they're all bad for growth, which is why, to some, we would say, why don't we delay this a year, and let's get the economy growing a little bit more before we would ever take on things that there's bipartisan agreement, in fact, are costing jobs. We don't have any jobs that we can afford to lose. So I just would leave that out there, that as we move forward in these uncertain times, the best thing we can do is all get in a room. We can talk about this. We can talk about the negative impacts. How could we change something in order to deal with the negative impacts and yet understand the cost associated with that, so that we can all have a little less uncertainty. And clearly today, the exchanges aren't open. They're not working. My own staff can't get onto the exchange here in D.C. It's not open. And yet, in a very short period of time, you've got to start putting your employees in buckets to prepare for a year down the road. So anyway, I think those are all facts that would indicate we should delay, but that's just my opinion. So again, thank you all for coming. Your insight has been very valuable, I know, and appreciate you taking time away from your business, traveling here, and I can assure you that this testimony is valuable to us. So with that, I ask unanimous consent that members have 5 legislative days to submit statements and supporting materials for the record. And seeing none, without objection, it is so ordered. The hearing is now adjourned.